Allergic reactions are the body's response generally to proteins. And when most people think about allergies, they're talking about proteins in things like pollens, which come from trees, grass, weeds, or in house dust mites, cats, dogs, cockroaches even. And once the allergic antibody response develops, re-exposure to those proteins causes the allergic reactions that most people think about relative to the nose, sneezy, itchy, stuffy, runny nose, itchy, watery eyes. Some people can have problems with cough, wheezing, shortness of breath, going along with asthma. And of course, food allergies are common these days, and people can develop after eating foods generally within pretty short order, within minutes or an hour or so, problems with hives, difficulty breathing, itching, a whole other host of things as well. Allergic conditions can affect pretty much any part of the body. So besides having allergic nose and eye symptoms, you can run into allergic asthma, cough, wheezing, shortness of breath. People with food allergies can have problems with nausea, vomiting, diarrhea, problems with itching all over the body. There can be problems with blood pressure even in the more severe reactions where people actually go into shock. There are several ways to test for allergy depending on what type of allergy problem you're investigating. If you're looking at allergy testing for things like allergic nose problems, asthma, then skin testing can be very quick and efficient. Basically, you put materials that people potentially could be allergic to on the skin. The skin is pricked, and then 20 minutes later, you have responses as to what you're allergic to. These days, we also do have available blood tests looking for allergic antibodies. They're pretty reliable. You do have to wait for the test results to come back. There are other types of allergies, though, that have problems caused not by allergic antibodies, but you might call them excited white blood cells. And for instance, if you are allergic to certain things that you get on your skin and you get into allergic contact dermatitis, that's tested for differently, and patches are placed on the skin, left in place for 2 days, taken off, and then you observe those particular sites over a number of days to see what type of allergy is identified through that process. Allergy medications work in different ways. One, most people are acquainted with antihistamines. One of the things that happens during an allergic reaction, including the nose, is that you get the release of histamine. And when you take an antihistamine, you're blocking the effect of histamine on the body. On the other hand, when you talk about other things that are going on, there can be inflammation. Antihistamines don't work too well with inflammation. And that's why other certain medications, such as nasal corticosteroids, become much more important because they are much more effective at inflammation. So there are other medications as well, but it's important to keep in mind how selective they are, which might help with specific symptoms. But if you're having more problems, you might have to have broader anti-inflammation effects, and different medications would be used.